My name is Greg, and I'm a vision therapist at Vision Clinic. It's a clinic that we do vision therapy for kids and adults alike, and in a variety of different aspects. We work obviously with traumatic brain injuries, acquired brain injuries, people who have eye turns, which could be, I guess, in, out, up, and down, kids who have learning difficulties, and also as well as enhancement programs for executives who want to perhaps kind of increase their stamina or kind of increase their skills so they're a little more efficient, as well as for sports programs like hockey and baseball and different programs. So yeah, we do a lot of different things, but traumatic brain injury is a particular interest of mine, as I obviously have gone through one myself. The place is Neurovision Clinic is owned and operated by Dr. Coralie Mueller. She has been doing vision therapy since 2011 and as Neurovision Clinic since 2016. So lots of good things, and we'll talk about a lot of different aspects of vision. So basically, before we get into specifically vision therapy, I thought I'd talk a little bit about myself. And I didn't have a clue what vision therapy was before I got hurt. So before February 5th of 2012, I had no clue. But I, after a snowboarding accident, had 6 years, what I like to call sabbatical neurology. So it took quite some time to get myself back to where I needed to be, back to work. And vision therapy was certainly one of the disciplines that helped me get back to it. I decided to change careers from communications to vision therapy, so I could help people who have gone through something similar that I have, and hopefully get them back to enjoying a quality of life just like I have. So the reason this picture is up, that was the picture of me before the accident, so I think we can all agree that I substantially have improved. So what is vision therapy? Vision therapy is a specialized area of optometric care. It's pretty well established in the States and Europe, and it's emerging more and more in Canada. So we used customized activities and that basically rewire the brain in order for it to work more efficient. The goal of vision therapy, and just like it says in the slide, is the main goal is to help you regain your quality of life. We work foundation up, so we want to create a robust binocular system. So essentially we work each eye separately in order to make the two eyes together work. And we'll talk a little more about that as we go along. The way you get, and the way really vision therapy works, is neuroplasticity. And neuroplasticity, which is probably a massive buzzword in the last few years, but essentially is, it's saying that we can learn new things. And it doesn't matter what age you're at, you can learn something new and we can create new pathways. In order for neuroplasticity to work, you need to have a novel, new experience, something that stimulates the brain. And then you need to, almost just as importantly, you need to make sure you have rest, so your brain sort of does the math in the background to put that together and create new pathways. So again, we start each eye separately, and we want to make sure that the brain-eye connection is super strong. So brain injuries and vision therapy. Brain injuries are in essence a central nervous system injury. And just like if you break a bone, get bruised, or you get the flu, your body's natural response is to create inflammation to attack it. So often you get neural inflammation. With neural inflammation, you get symptoms like you have trouble with motion, you have trouble with light sensitivity and sound sensitivity. You get what most people like to call brain fog, which is essentially trouble focusing. So the first thing we really need to do is to start trying to figure ways to regulate your central nervous system and bring down that inflammation. So what does a vision therapist do? I like to say that we're essentially guides to help you rewire and create new pathways so that your visual system as a whole, and your visual system includes not just, and we'll talk again about this in a bit, 20/20, seeing your 20/20 prescription. There's a lot more to it. So we want to make that whole visual system as a whole efficient and as automatic as possible. So have you ever experienced any of these? And I would guess a good portion of people who have had any sort of brain injury have have experienced a number of these. Myself in particular, absolutely. Reading was super difficult in the beginning. I couldn't read a word. I couldn't put pen to paper for that matter, but couldn't read a word for a while. Then I slowly built up to reading the words, a couple words, and then a sentence, and then slowly towards a paragraph. It was a super hard struggle for me to get reading back. Definitely had brain fog. I had light sensitivity coming out the wing wang. My wife actually garbage bagged our bedroom in order to stop the light from coming in. And I used to wear like sunglasses going to grocery stores and whatnot. I don't know if I'd highly recommend that nowadays. I feel like you need to get back at it a little quicker, but it certainly was something I struggled through. Sound sensitivity, very similarly, I had it pretty bad. I wore earplugs everywhere for a long time, which, to be honest, in this day and age, I don't know if I'd recommend either. But even, for example, this morning there was a truck backing up, and that beep, 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 beep just drove me insane. It was horrible. Yeah, short-term, long-term memory issues. I 100% had short-term memory issues, which is super hard when you're going to like a neurologist or I saw a neurosurgeon, and you don't remember what they're saying. So certainly suffered through that. Another one there would be following moving objects. My daughter was born pretty early on in my injury, and just before, and I pushing her on a swing, for example, I'd have to shut my eyes, push her and feel for her to come back, and then push and feel it because I couldn't watch the motion. It made me sick. Dizziness, headaches, yeah, which are super common ones. I had problems with gait, which I'll talk a little bit. I had a midline shift. And conversations, if I had a one-on-one was hard enough. If I had like a third person in the actual conversation, I'd get panic attacks and anxiety attacks. So yeah, post-traumatic or any kind of brain injury symptoms are super difficult to deal with. So what's unique and what's interesting is your brain is just like this says again, is unique as a thumbprint. Your brain is unique to you. There's nobody's brain like yours, just like your thumbprint. And because of that, your symptoms are unique to you to a certain degree. And I always tell my patients, yeah, there's a certain degree I can relate. I can go, okay, I can understand where you're coming from. And I've felt something similar to that, but it's your own sort of journey. So and the reason I say that is that I don't let people tell you that you should be better by now or buck up and deal with that and go through that pain or whatever it is. You be your own gauge and your own advocate and know what you're feeling is real. And the other one is the 1 year into a brain injury where they say, after 1 year that you are where you're at. That's obviously not very accurate considering I took 6 years and I'm fine now. So yeah, don't listen to that. That's old school stuff, and truly listen to yourself because you know you better than anybody, really. Yeah, and after a period of time, if there's certain visual symptoms still arising, you get what's called a post-trauma vision syndrome diagnosis. We'll talk a little about that. So yeah, there's a variety of things here. Reduced accommodation with that, it's like it says, being able to see clearly. I wasn't able to see this computer screen. I wouldn't have been able to see that. I wouldn't have been able to see the wall that's about 10 feet away. So accommodation is massive with your vision. Reduced convergence is really basically the ability to look up close and often affects your reading, which again, we'll talk about in a little bit. Decreased blink rate. I used to use eye drops. I mean, I should have had stocks and blink because I used a lot of eye drops for a long time. And I guess, I don't know the specific stat, but it's a large percentage of people who've had brain injuries actually do have a decreased blink rate and therefore generally dry eyes. Another thing I used that I thought was super helpful was a warm face cloth. Just put it over your eyes and let it sit. Like I said, I had photophobia and phonophobia, blurred vision and double vision, 100%. The visual midline shift's the interesting one because I want to say I wrote down the stat. It was like 93% of people who have TBI or concussion or have a bit of a midline shift. And a midline shift is essentially that your brain perceives that your physical center is not there. So if you think, so your physical center is here, your brain's perceiving it might be over here. a little bit over, it's off. And that'll cause you obviously balance and walking issues. That's where the gait problems come in. It causes you generally, it made me just feel sick. It just made vision tough. And actually there's a way, a very rudimental way of testing for it, which you could try if you had a pencil. Frankly, you could use your finger. Let's just use your finger. So you could use your finger. And if you were to make sure your head's straight, so maybe look towards your computer screen and then look at your finger from roughly your shoulder width, and you were to slowly bring it towards your midline. So you want to bring it towards your nose. If you brought it towards your nose and you just say, okay, that's my midline, it should be straight. With a midline shift, and mine was like over here, it would be like, I'd come over here and it would be perhaps there. And and you wouldn't know it. Most times you don't even know you had a midline shift, but you could test it from the other side too, because sometimes it varies. And, in theory, it's straight. So, and again, most people, believe it or not, don't even know it's happening, that they have a shift, other than how you're feeling perhaps. But so talked a little bit about central nervous system. The central nervous system, often from brain injuries, has been thrown truly off whack. It's almost like a chemical warfare is going on in your brain. And with that, you get your basically here, your autonomic nervous system has been stimulated. And part of that autonomic nervous system is what's called the sympathetic nervous system and the parasympathetic nervous system, which sounds like a lot of big technical words, but basically your sympathetic nervous system is what most people know as your fight and flight. And then your parasympathetic nervous system is your rest and digest. And they're always sort of going in balance. They're never really, and they shouldn't be, stuck on one. They're sort of just balancing one another out. Unless, of course, you go and get it stuck in there. And that's what happens with a lot of brain injuries. So what happens here with the fight and flight? So let's say you're out on a walk in like a forest, and you're going for a hike, and then you come across a big mother bear and their cubs. So the big mother bear is going to be angry, and you're going to go, oh no. Right then your sympathetic nervous system sort of engages, and what it does, the sympathetic nervous system essentially tells you you're in danger, and it gives you the energy to get out of danger. So that's where you can either fight, run, whatever you need to do. Once you get to, let's say you run away from the bear, or she just leaves you alone, that's when your parasympathetic nervous system, or your rest and digest, comes into play, because it helps you recover from using all those stress hormones and neurotransmitters that shoot up into your system. So here's the problem after brain injuries: when you get stuck in fight and flight. So if you get stuck in it, you're getting these they're stress hormones and neurotransmitters that give you energy, like adrenaline and cortisol. And when they get all shot up into your system and they stuck there, they're, like I said, they're good for a moment, so they give you the energy, but if they're stuck in there, it's not good for your brain. It's never gotten back to that rest and digest and into the recovery mode. So if it gets stuck, that's where the brain fog comes in, and that's where you're not allowing yourself to heal. So our first steps here essentially is to, like I said, to attack that neural inflammation, but the stress, the fight and flight part, and relax yourself. So within your eyes, this is what's happening when that sympathetic or that fight and flight engages. So your eyes, they start to dilate, and that allows more light in, also more ability to see clearly, sorry. But it does decrease your ability to look up close. Because what it does, they're naturally, and when your eyes diverge, it means they're going out and looking far. So it creates that ability. So probably so you can run away to someplace is really what it's doing. You lose your sort of depth of field as well a little bit. But for the most part, you're able to run away and see where you're going. The problem is, if it gets stuck in that, then you start having kind of the opposite effect, whereas your periphery is open naturally. If you're getting too much of that stress hormones and your neurotransmitters, and your brain's out of whack and too much stimuli, then your periphery actually shuts down because it's just too much for your brain to handle. So you actually start losing your peripheral, which is anything outside your central. So a lot of people with brain injury notice that they kind of have this kind of tunnel vision sort of syndrome, and that you can only see in front of you, and that's why you're bumping into things. That's why it's difficult to read. There's the variety of things that losing your periphery does, which we will talk a little more about. I mean, it tells you right there, actually reading and tracking. Yeah, the midline shift syndrome actually is a peripheral dysfunction, and this is why it's happening. Vagus nerve. So now we start talking about how to regulate that central nervous system. The vagus nerve is the longest nerve and the largest nerve in the body, and it connects to the heart, the lungs, and the gut. And it's a huge part of the parasympathetic nervous system. And there's multiple ways that you can sort of engage it. The simplest way, to be honest, is just breathing. And that's why when you see someone who, you know, just witnessed an accident or somehow stressed out, you say, well, let's just breathe. Nice and breathe. Breathing actually starts to activate that parasympathetic nervous system. You know, nice slow breathing. What else can we talk about? Oh yeah, humming. Humming is another good one. Humming, for example, I've been doing this most of my life and not realizing it was even activating the vagus nerve. I used to do it when it was on planes. I would hum the Indiana Jones theme for some reason, and that's just what I hum. So I go, and little did I know, it was actually relaxing me for the reason of this. It was activating the vagus nerve. But humming's a simple way. So if you're out somewhere and you're starting to get anxiety issues and whatnot, you could start humming. If humming's not your bag, you can start singing. Singing is another way of doing it. And it doesn't matter how good or bad a singer you are. You can sing in the shower, sing in the car. Singing is super good for the soul. So I would say sing, no matter how bad or good it is. Learn from kids. Kids sing and they don't care. And it's a good way to help them regulate their system as well. And as well as singing, I guess the other way you could do it, if you had a glass of water, you could gargle. Gargling helps you to, again, activate the vagus nerve. It's kind of crazy, isn't it? But anywho, so yeah, breathing exercises and is sort of a meditation exercise, and we'll talk a little more about that too. So here's a specific breathing exercise that I actually learned from the Brain Association when I went to it in one of the, I believe it was a yoga class. Might have been a breathing class specifically, but it's called 4-7-8 breathing. I think it's also been called 4-6-8 breathing. I don't think the numbers matter dramatically. It's just about sort of controlled breathing. So what you would do here is you would breathe in for 4 seconds, you would hold for 7 seconds, and then exhale for 8 seconds. From my understanding, the better way to breathe is actually through your nose and out your nose. You really want to use your mouth when you're doing massive exercise. So you want to have it controlled through your nose. So what we could do here, and I can count this out actually, we'll do a little quick trial. You'd want to do multiple of these to really take effect, but this is one of my go-tos. So what I'll do is I'll count 4 seconds. You try breathing in, and then I'll count the 7 seconds, just hold it for the 7, and then breathe out for 8. And like all meditations, don't stress about if you get the numbers right, get the hold right. I mean, meditation, I mean, your brain just normally is going to wander and go all over the place. So be kind to yourself and don't worry if it's perfect. There's no such thing as perfect. So let's give it a shot just for the sake of giving it a shot. So we're going to now breathe in for 4 seconds. And now let's hold it for 7. And then slowly breathe out the 8 seconds. And that, like I said, it's slowing down the system. It's activating the vagus nerve as well. And I would say do multiple of those and you can help start regulating your system up a bit. So other ways to combat neural inflammation. And yeah, nutrition, meditation, and tonics we'll talk about here is sleep, exercise, and of course, vision therapy. So the first one we'll talk about is nutrition. Nutrition is actually pretty big. I wish I was sort of told about this in the beginning, because I certainly didn't follow this at all. But you want to have a sort of an anti-inflammatory diet. So you want to knock off red meat, believe it or not, is inflammatory. Knock off carbohydrates, like gluten's horrible for you, and knock off refined sugars, or knock off most sugars, but refined sugars in particular, and fried food. Limit that essentially. And you can start increasing your fatty fish and your almonds, your walnuts, your anti-inflammatory berries like blueberries, and lots of leafy greens. I actually, probably a month or two ago now at this point, but I went to hug my daughter and she woke up like in the morning, and she woke up suddenly and she hit me in the head. And for someone who's gone through a head injury, you often sort of get sort of symptoms kind of come back, maybe not in the whole, but a little bit of symptoms. So I went specifically on my anti-inflammatory diet as well as supplements, and I did a float tank. I suggest float tanks, people. If you ever heard of a float tank, there's a float tank in Durham that's brilliant, but it helps sort of reset the brain. But yeah, I went on this diet and I did my omega-3s, like it says there. Make sure the omega-3s is a DHA higher than EPA. EPA is more cardiovascular, but they work together, of course, but you want a higher DHA. I also recommend high absorption magnesium, and we'll talk a little bit about that because it helps with sleep as well. MCT oil, which is essentially coconut oil, is anti-inflammatory. Vitamin C's anti-inflammatory properties to it. Vitamin D and vitamin K is another one. The turmeric is another great one, actually, or curcumin from it. But yeah, I basically did my little concoction of stuff for a week, and I was good pretty quickly, which was impressive. So I wish I had that in the beginning, because I'm sure it would have helped me along the way. We talked a little kind of about at least mindfulness and meditation has come, because that 4-7-8 breathing is sort of kind of a mindfulness activity. But neurologists in particular suggest doing a minimal of 2 20-minute sessions of meditation a day. Meditations, like I said, come in all shapes and forms, whatever works the best for you. My main encouragement is to don't get frustrated with it. I used to try them and I felt like I wasn't doing well, and my mind wandered. And when that happens, you start thinking you're not doing a good job, but no, your mind's going to wander. It's going to go off. You just sort of gently bring it back and sort of keep trying to relax. I use my favorite kind of go-to meditation is called a body scan. And if you have, I don't know, I'm not trying to promote anybody, but I use the Calm app. The Calm app is brilliant. It has a lot of different variations, and they're very good. The people who do the speaking of it's great. But I do a body scan, and a body scan, if you don't know what it is you have someone's guiding you through sort of, you've just shut your eyes and relax, and you're feeling different sensations. So the guide, you say, what kind of sensations do you have in your left foot? And then you go and sit there for a minute or two, and then your right foot, and they go through your body, and it allows you to, by focusing on one particular part of your body, it sort of melts away the rest of the stuff or the stress or whatever else you're dealing with. It's a way of by focusing something to relax. I definitely recommend a body scan, but I mean, each their own on that for sure. Syntonics. Oh, I don't even know how to go back. How do I go back? Yes. Technically. Anyway, syntonics or light therapy is also sometimes called optometric light therapy. It's basically using, sorry? Oh, I thought somebody said using specific frequencies of wavelengths of light to improve the balance in body's regulatory centers. But the ones that, the version that I think most people would be, it's been used for like 80 years or something on, like, for lazy eye, which is really a lazy eye is when your eyes shut off. For head injuries, of course, and we use it for eye turns with kids, and obviously dealing with anxiety, and that's what I used it for sure. But a couple that a lot of people are probably familiar with is newborn babies who have jaundice. They give, and in fact, my daughter had it. It's like an orange light, if I'm not mistaken, orangey red light that they used, and also people who have seasonal affective disorder often use a blue light to help them feel better. So. Yeah, it's like I said, I use it for anxiety. We have a program here that we put people through that helps with trauma. It's believe it or not, quite effective. Sleep. I talked earlier about how, with neuroplasticity, you need sleep, and the second portion of that, really after the novel new experience, is to make sure you have proper rest. Sleep is massive. If you feel like you're tired during a brain injury, whenever that point is, if you're able to go rest, lay down, your body's telling you what to do. It's telling you. So if you're tired right now, go lay down. This is recorded. You'll be okay later. Because you need to listen to yourself. Sleep, as many people who've gone through a brain injury know, is tough. I struggled tremendously with sleep. I went through trying sleeping pills and melatonin. They even I had a period where I wasn't sleeping for like 3 days in a row, and they gave me Ativan just to get me knocked out, essentially, to do it. So sleep is massive. So my favorite remedy, what worked for me in the end, and still works for me, what I use to this day actually, is high absorption magnesium. You want high absorption because it kind of flows out of you otherwise, but it helps relax and sleep. Meditation, of course, and then the other one would be exercise, which we'll talk about in a second. Exercise helps you relax, of course, too. So yeah, get as much sleep as you can because it will certainly help your body heal. Exercise. So yeah, obviously beyond the true cardiovascular and all the other health benefits we know of exercise, it decreases the stress hormones, increases your transmitters. It sends those transmitters all throughout the brain. It's one of the big ones here. If you look at point, what is that, 5 there, enlarges the areas of the brain associated with memory, task management, coordination, planning, ambition. That's all stuff that you get knocked off when your head gets hurt. So exercise is big. So if that means, and I think this is how I started, was just little short walks in the house. Go for a little short walks in the house. Get moving as soon as you can. So don't wait. Try to get on that as soon as you feel comfortable doing it, and do it in little increments and start building up. I mean, I worked my way up to like a 2-hour walk every day, and that was certainly a part of the reason why I got back to where I'm going. And like it says there, it lowers cortisol too, which is a damaging kind of, if it's done too often, it's not ideal for you. And then, of course, vision therapy. Vision, believe it or not, if your eyes and if you're dealing with this now with any kind of visual issues, you'll realize that it does cause stress on the system. If your eyes aren't aligned together and you're seeing a bit of blur, you're going to feel not good and your anxiety is going to go up. So the more you improve your visual system, you'll actually feel better overall. So, I mean, not only will it get back to your normal life, it will make you feel better. So that's what we do it for. So your eyes are part of the brain. Not everyone seems to realize that, but they're truly connected. They're literally connected. So, if you were to get a fall or an acquired brain injury, or you were a sports accident, or whatever way that you hurt your head, it stands to reason then, of course, if it's a brain injury, it's going to be a visual or a vision injury as well. So that's why we call it neural vision. I think that's why, because it's people don't separate; they're one and the same. So because we know that a brain injury is also a vision injury, this is why we assess magnitude of things instead of this 20/20, which is what we'll talk about in 2 seconds. This is what we assess. So most people probably have ran into someone who has said that their vision is perfect. I have 20/20 vision. And good, yes, it's what it's considered as acuity, the way you can focus on something. So it's good, but what it is, it's measuring if you can, now my wall's 10 feet roughly away, but it's measuring if you can see a certain size font at 20 feet away, and that determines your prescription. Athletes actually have closer to 2010, 2013 acuity or that. So, but we measure the whole visual system because there's more to vision than just seeing it clearly. So we start looking at how accurate your eyes can jump from one target to the next. If you can follow a moving target, your ability to, and we talked a little bit about the central peripheral, look straight, focus on something, but being aware of what's going on around you. Using both eyes together and aligned at the same point. And without that, if you look at the graphic that's on the screen, the blurriness, if you don't have your eyes aligned together and they're off just a teensy bit, you'll start getting blur. And then after that, the stage would be double. So you want your eyes aligned. Be able to look distance to near, of course, and back and forth, and as well as up close and comfortable up close, which is usually a brain injured person's most difficult task, is to the near point stuff. So we're going to look at something that with all likelihood most of us can relate to, is issues with reading, and we'll look at a few skills that allow you to read. Focusing clearly, of course, using both eyes together, aiming at a particular spot accurately, smooth and accurate movements. You're jumping from one target to the next, and then, being able to look with your periphery. So here we go. Accommodation, that's your 20/20. And it's like, basically, if you know old school 35 millimeter cameras, it'd be like adjusting the focus point on something and getting it clear. That's what your 20/22 is. It's massive though. You do obviously need it, but it's like I said, it's not the be all end all necessarily. Eyes lining together. This one probably more, well, it's not any more important, but it's super important. So when you're looking at any image, actually, the way you could do this, if you were to take your finger and look at a far distance, look wherever you can at a distance, but look at a target, and then put your finger about, I don't know, what is that, 5-6 inches away of your face, you should see two fingers. And that is because we see two channels. We have two channels, two eyes. So what happens is both eyes need to be aligned on the same target, and then your brain essentially does the math and fuses them together into one target. And that's where you get three-dimensional, but that's just where you get one target. If your eyes aren't aligned together, like I said, what's going to happen is you're going to get a little off, you'll get blurriness. And if it's really off, you'll get two, because then you start having both those eyes. They're not doing the math. And that, well, affects a lot of different things, but we work, what we do is we work monocularly. So we work each eye separately, making sure that the right eye can track up and down nice and smoothly everywhere, can see clearly. And then you make sure the left eye is doing the same thing. And then we start putting them together. That's 90%. At some strabs, you start binocularly, but for the most part, and for TBIs in particular, we definitely work separate eyes separately, get them nice and strong, and then put them together. Fixation is exactly what it says here. It's basically the ability to aim your eye at a particular target. And believe it or not as easy as it sounds, especially for people who've had brain injuries. Good fixational skills essentially allow you to maintain a steady gaze and not knock off that target. Some people who have gone through brain injuries might have experienced this, as they'll read and then you jump a little bit, and that's just loss of fixation. So we definitely work on fixation. Smooth and accurate eye movements. It seems kind of logical, doesn't it? But you know, when reading, you read from left to right, and then obviously down to the next paragraph. So you got to be able to read smoothly left and well, we work both left and right, and up and down. So a good example, or a little activity we can try here, just to test your own smooth, accurate movements, as well as a little bit of fixation, is if we call it thumb slides. So if you were to put your thumbs up, eye level, just in front like this. We can try this in a second, actually. And then what you're going to do is I'm going to take the right thumb, and all you do is you follow it out to about shoulder width, and then you slowly follow it back. And then you do the other side. And lots of people, I don't know if you can see me while doing this, but lots of people will jump back to the thumb on the way back in particular, it seems to be. So you go around there and then, or they jump off it. So it's hard to hold on to it. And the more you do it, that's where the fatigue factor comes in. And a lot of our work is to build up stamina as well. So actually we can take a second. Let's just try that for the sake of us. Everybody put their, I don't know, hitchhiker thumbs up here, and we'll slowly try. So just pick a thumb. I mean, I would start with the right one and then slowly bring it out shoulder width. Just keep the fixation on it, keep watching it, and then slowly bring it back in. We do most of our activities slow and controlled because you want to be out of control. And just nice and slowly back. And then of course you could switch it up and do it sort of thumbs on top of one another and do the vertical. So same thing, you want to start at eye level, and then you want to slowly up to around head, or as far as you can see. My glasses are going to block off a bit here. Same thing, follow it down. So give that a try too if you want. What you'll notice, and most people do, is one gaze, one direction often is a little more tough than the other. I believe in my case, going through the injury up and down was a struggle. But yeah, we normally do about 25 of them. So the more you do, that's where you might fatigue out halfway, and then you might jump and lose fixation. Might be fine too. Hopefully that's the case, because that's what they aim. Saccades. Well, saccades is another portion of reading, and that is basically you want accurate jumps from letter to letter, because that's what your eyes are doing, and as well as word to word in order to read across a page. So we can do another activity of, I'll leave up there, activity of to sort of show that and see how you feel with that too. So what you do with that is you would go about shoulder width, and I always start in the right for some reason, and you go as quickly but as accurately as you can to this thumb. So you want to jump right to it, back and forth. And again, you do 25 of these. So one or two might not seem too bad, but once you start doing more, that's where the fatigue, or that's sometimes we just lose your alignment. And often again, you'll be jumping, you go in the middle there, or you jump and you're not quite accurate. But it shows how important the skills are to reading. There's more to it, again, than just 20/20. Anybody feel that was hard? Might not have been. I've done it so much now that it actually becomes stupidly easy. But I mean, I see people on a regular basis that it's hard to work. It's hard to do. Central peripheral integration. I mean, there's no skill that's more important than others, but I think this is massive. It helps with reading. It helps with sports. It helps with balance. It's just, it does so much. It allows you to see more of the world. It's just, yeah, you normally feel better once people get this fixed up. It's great. So it's basically, go ahead. Oh, was there a question or not? It's okay. So central peripheral is, and I think I kind of mentioned this earlier, but basically being able to look straight at a target at a distance and being aware of everything that's around you. So it's the sides, it's above, below, it's everywhere else a bit, essentially. And often, again, like I said earlier too, with a brain injury, that sort of collapses and you start losing it. You only have bits, and that will prevent, like when you're reading, for example, if you only have that kind of chunk reading, you can't see the word ahead of you. So it's not as smooth. You miss punctuation sometimes. In fact, when you do it, because you're sort of reading word to word, it's super choppy, you sometimes don't even understand what you read by the end of it. So opening up your periphery is a huge thing for TBI patients and really everyone, kids as well. Actually, a good activity to test this sucker out actually too would be to, if you can look at the computer screen or you can look at a distance. I'm always looking past it. I have a chart that's kind of straight ahead of me. So if you look at that straight target ahead of you, and the way we test it, weirdly enough, is to do this, but you don't have to. You can do this to make yourself look silly. And then what we do is you say, call two things out to the left. So I can see I have a bowl of berries to my left, and I can see a spinny chair, a chair over to the left. And then if I'm looking to my right, my water bottle, and I can see my phone. And then above, I can see the lights and a bit of the ceiling. And below, I can see a paper. It's harder below for me. And, oh, my garbage can a little bit. So give it a shot, actually. It's worth a little test. Don't worry about I don't know. This is how the doctor really likes to do it. But if you want, look straight ahead and just see how much you're aware around you. Take it, I would, it's a good little test. Take a second just to see if you can call out two things in your head, of course, and can you see two things to your left? Can you see two things to your right? Can you see two things above you? Can you see two things below? Is it easy? Well, holding that fixation on that central target. A lot of people tend to kind of jump off and go, oh, okay, that's over there, or that's over there. It's a tough one. For brain injury people, it's 100% normally, it's something that everyone has a problem with. So the vestibular system. So the vestibular system and the ocular system, well, your vestibular system is essentially your balance system. And as it says here, it gives you information about motion, head position, and spatial awareness, and stabilizes you. The vestibular system and the ocular system are both back in the back of your brain, and they're neighbors essentially. They work hand in hand, more so than most people believe. One of the ways to, I'm just thinking, I don't know how to show it to you, but one of the ways to test it, if you wanted to try this, would be to stand up and stand on one leg for a second. See how that feels, and then shut your eyes. And then you'll see if you can still stand. Your balance should be worse. You know, it's more difficult usually. The other way to do it is to, actually, I'll show you the next slide. So the eye muscles there, when you turn this way, your eyes actually turn the opposite way that you're moving. So if there's a test that if you used to put your feet one in front of each other, like literally heel to toe, and then kind of did like a cross or put your arms out, and then if you shoot your eyes to the left, you should ever so slightly shift to the right, and vice versa. Obviously, if you shift your eyes to the right, you should shift a little to the left. Because yeah, the what's called the vestibular ocular reflex or ocular reflex, it lets you know when you move through space that your body's still moving, but the world is not. And we stimulate the heck out of this with a whole bunch of different activities, because most people with a brain injury, this is knocked off quite a bit. But yeah, you could try one of those tests if you so choose, but or at a later date. But yeah, they're super connected to your vestibular and your visual systems essentially. And yeah, like I said, if you did the test, you'd probably really see it. Super important though. So vision therapy as a whole, how we can help. Yeah, what Dr. Mueller would do would, and we now have another associate, Dr. Chow, she would, or either one would do a full visual functional exam, and that takes like an hour and a half, 2 hours. And then from that and some other testing, often they'll give you an individual program that's specific to what you kind of need. That program, of course, is similar to what we've talked about, is to help create new connections and make the eye-brain connection stronger. The goal, of course, is to improve those eye tracking, the eye teaming, the focusing, and make everything automatic and simultaneous. But ultimately getting your system so it's so working on its own that you don't have to think about it, and it's strong and build up stamina. So even if you're tired or sick, it's not going to affect you. I know when I was going through my head injury, when I was still in the middle of therapy and not near done, I would, if I was sick, my visual system would just shut down, sort of, or you definitely noticed it. So yeah, we want to make a nice, strong, robust system so you can deal with basically everything that you have to deal with in a normal life. But that, hopefully, it didn't go so quick. I felt like I didn't have enough time. So any questions, by all means, please ask. I believe that's it. Yeah, that's what I did.